Hello, I'm Dr. Israel Barken, the Medical Director of the Prostate Cancer Research and Education Foundation. Every Tuesday at 6 p.m. Pacific Time, we have our Ask Dr. Barken call-in show. The number you dial is 1-877-727-3301. During this show, we always have segments where I discuss some abstracts, and today I want to discuss the following abstract. Phase 2 trial of Avastin, Thalidomide, and Taxotere and prednisone in patients with metastatic castration-resistant prostate cancer. This article was published in the Journal of Clinical Oncology, March 2010. So let's discuss the article now. The purpose of the article is quite simple. The researchers noted that thalidomide together with Taxotere had some good effect in that combination. Other studies showed that in phase 2 study, combining Taxotere and Avastin also had a substantial anti-tumor activity. The intention was to find out if combination of Taxotere plus these angiogenic drugs with different targets would be a substantial clinical activity added just by the fact that we combine these two drugs together with the Taxotere. And they decided to explore safety and efficacy. This was tested in mice and also in human. So let's go now to patient and methods. Preclinical efficacy of combination therapy was already evaluated in PC3 mice model. In this study, in the current study I'm discussing now, 60 patients with progressive metastatic prostate cancer disease, the castration-resistant prostate cancer or the hormone refractory disease, they received infusion of Taxotere and Avastin together with oral medication thalidomide. The primary endpoint was the PSA response decline of more than 50%, and the secondary endpoints were time to progression, overall survival, and safety. The results. In the mouse model, combination therapy of Taxotere, Avastin, and thalidomide inhibited tumor growth most effectively. In the clinical study, they found out that 90% of patients receiving a combination therapy had a PSA decline of more than 50%, and 88% of the patients had a decline of PSA more than 30% within the first 3 months of treatment. The median time to progression was 18.3 months, and the median overall survival was 28.2 months in this group. The predicted survival for this group was 14 months, and yet the survival was double at 28 months. While toxicities were manageable, they describe in this article, all patients developed grade 3 to 4 neutropenia, which means decrease in the white count. In conclusion, the addition of Avastin and thalidomide to Taxotere is a highly active combination with manageable toxicities. The estimated median survival is encouraging, given that this group had poor prognosis to start with. These results suggest that definitive clinical trials combining angiogenic agents, combining it with Taxotere, are warranted to improve treatment outcomes in patients with metastatic castration-resistant prostate cancer. Thank you for listening. I hope to have you on my show every Tuesday at 6 p.m. Pacific Time. This is Dr. Barken, wishing you all the best. Goodbye.